So many of you have sent me Jim Carrey to review and analyze, and so here we go. He's one of the most expressive faces in Hollywood, and now his look is under scrutiny. Many of you have noticed some differences over the last few years, but let's examine Jim Carrey's facial evolution from the very beginning. And let's see if the changes can be attributed to just aging or if they're a sign of something more. As always, the total cost of potential procedures will be presented towards the end of the video. In 1981, at the age of 19, what I see is that Jim Carrey has a centrally based hairline part. You can see where the hair flows more to the right, and then it transitions to flowing more to the left, right around the middle of the hairline. He also has low-set, flat brows. Jim Carrey has a prominent orbicularis oculi muscle right here by the lower eyelid. He also has full tooth show when he smiles. And of course, as we all know, he has that nice, prominent, strong chin. In 1982, at the age of 20, what we see here is how highly expressive Jim Carrey is, and what makes him such a master in the various roles that he's played. And this is partly why we all love Jim Carrey. In 1984, at the age of 22, what I see is that Jim Carrey's lowest horizontal third is also his longest when it comes to the various facial segments. He has a fairly narrow nasal bridge as well as his nasal tip. In 1985, at the age of 23, Jim Carrey has what looks to be a possible scar at the left lower eyebrow. He also has a thin upper lip. And when we look at his cheeks, what we see is that there's limited cheek volume, and he has a flatter lateral cheekbone structure that becomes relevant later in this video. In 1988, at the age of 26, what I'm seeing here are well-defined philtral columns, as well as a relatively short philtrum. As you know, part of what I do for a living is shorten the philtrum for people where that philtrum is longer, or if they're looking to increase the volume of the lip or to increase upper tooth show. Some guys do present for lip lift surgery, and I find that a very small percentage of them are actually good candidates. Jim Carrey, for example, would not be a good candidate because of that already shorter philtral distance, as well as the upper tooth show that he already has. In 1990, at the age of 28, I'm seeing here that Jim Carrey has some upper eyelid laxity, and that excess skin does mask the supratarsal show. In 1991, at the age of 29, what we see is that Jim Carrey has a loss of his baby hairs in the frontotemporal corners. A common request that I get from guys coming to me for improved hairlines is that they're trying to regain that curvature that once existed. But what I tell them is that by the time people reach their 20s, that curvature is almost always gone, and there will be this natural frontotemporal corner or some degree of recession, and reproducing that is actually much more natural than artificially creating a very strong curve, which is actually a more feminine design. In 1992, at the age of 30, I see no change. And in 1994, at the age of 32, what I wanted to point out here is that Jim Carrey has strong temples. You can see his anterior temporal peak, and you can see how nicely that temporal area comes up and connects to the rest of his hairline. In 1995, at the age of 33, what we see here is that Jim has highly defined cheek folds, and that of course goes along very well with his expressive nature. And again, keep this in mind because it becomes more relevant with some of the more recent years and some of the changes that we now see, and how it takes away from that very expressive lower cheek area that we're so used to seeing with Jim Carrey. In 1996, at the age of 34, I see no change. And in 1997, I also see no change. In 1998, at the age of 36, we see that Jim now has more forehead rhytids or wrinkles forming. He also has infraorbital hollowing that is starting to increase with the aging process. And his cheek volume appears to be somewhat deflating, very gradually, but you can see that the cheek does look flatter compared to prior years. In 1999, at the age of 37, I see no change. And in 2000, at the age of 38, we see those very prominent forehead wrinkles. So there's definitely no Botox at this point. In 2001, at the age of 39, we see that Jim has slightly deeper frontotemporal recession. He overall has a well-preserved hairline, but of course the corners tend to recede as we age. And one of the key things that helps prevent that process and helps people prevent further hair loss around their entire scalp is finasteride. Remember, finasteride blocks the conversion of testosterone to dihydrotestosterone. DHT is the stronger version of testosterone that binds to our hair follicles in those DHT-sensitive zones and causes miniaturization and hair thinning over time. So a lot of guys will start on finasteride to prevent further loss of hair. And one of the common places where they're getting the finasteride is at feelconfident.com, because you fill out a questionnaire, and as long as there are no contraindications in that questionnaire, the medication is essentially sent to your door. And this is available in the United States, and it's a very convenient way of getting finasteride. And before you go and make fun of me, I have an autoimmune type of hair loss, alopecia areata. I had universalis at one point, and now I have some spontaneous return of some hair. You could see some eyebrows, some mustache. Some patients find it really funny that I'm growing out my mustache, but you know, why not? I have it now, so I'm gonna flaunt it. But yeah, I've made videos about that many times, but you know, I still get the comments about why is this guy with no hair talking about hair loss. In 2002, at the age of 40, I see no change. In 2003, at the age of 41, we see that Jim Carrey's crow's feet are starting to settle in more. So those lines are becoming more obvious and a bit more etched in. In 2004, at the age of 42, now that Jim Carrey has shaved his head, we can really see where his hairline is and its exact configuration. And you can see from this top-down view that Jim Carrey's nasal tip has some degree of deviation. And in 2005, at the age of 43, I see no change, and that's the same through 2007. In 2008, at the age of 46, we're seeing here the glabellar rhytids, or wrinkles, right here between the eyebrows. They're becoming more pronounced, including the horizontal crease that you see here. And that is where the procerus muscle lives. Remember that the lines form perpendicular to the fibers of the muscle that lives beneath. So the procerus muscle runs like this, and then that's why you see this horizontal line. So when people are doing Botox injections for the glabellar area, in addition to targeting the corrugator muscles where those 11s form, it's important for some patients to also target the procerus muscle so that you can reduce that horizontal line. Again, not everyone wants to get Botox, and that's all well and good. But if someone is getting Botox, you have to keep these muscles in mind. In 2009, at the age of 47, I see no change. And in 2010, at the age of 48, we're seeing here that Jim Carrey now has increased frontotemporal recession. And this is occurring as the temples themselves are starting to thin, and they're starting to get more concave. As that happens, the corner begins to open up more. So when we're doing hair transplant surgery at the hairline, one common thing that we do in my practice is that we start to incorporate the temples whenever possible to improve that configuration and that contour to a more natural, rejuvenated state. Now, that is a difficult type of transition to follow for many surgeons because the angulation and direction is changing quite a bit. I have an entire video on how we restore the temples. For anyone interested, go check that one out. In 2011, at the age of 49, I see no change. In 2012, at the age of 50, I also see no change. In 2013, at the age of 51, what we see here is that Jim now has increased upper eyelid redundancy, as the brows have descended and there's more skin laxity forming in the upper eyelid area. That tends to weigh down on the eyes, and in addition to reducing the supratarsal show, for some people it gets so severe that some of their vision can actually be blocked with all that extra skin. And that sometimes will actually lead to a patient getting a brow lift and or upper blepharoplasty to improve their vision. It's not always just for cosmesis. Sometimes it's just for these functional reasons, and in those situations, insurance will sometimes pay for those procedures. In 2014, at the age of 52, we're seeing here that Jim has increased submental fullness, especially when we compare back about 10 years to him at age 43, where now you can really see that there's just more going on in the submental space compared to him in his 40s. In 2015, at the age of 53, in addition to sporting this wonderful beard, the only other change that I'm seeing in Jim's face is that from the aging process, he has some increased temporal hollowing. So that's the area here, lateral to the orbital bone, that's starting to thin out a bit. And in 2016, at the age of 54, I see no change, and that's the same through 2024. We have a great newsletter available at feelconfident.com, so if you haven't signed up for it already, please make sure to subscribe to the newsletter so you can stay up to date on all the latest hair science, hair restoration news, as well as facial plastics updates. Oh, and make sure to try our brand new scalp serum if you haven't already. In 2025, at the age of 63, let's go over a few different areas and features of Jim Carrey's face and figure out where there might be a change. So when I look at the hairline, I'm really not seeing any changes. Next, the rhytids or the wrinkles of the face. To me, they look very similar. So again, no change there. When we assess the brows and the eyelids, I think they're in the same general position and have the same amount of skin redundancy as they did prior. So again, no change. Next, in looking at the lips and the chin, to me, they look about the same, so no change there. But something looks different about his face compared to even 2024. What might it be? Well, in looking at the cheeks and the temple area, to me, they look fuller. And that is likely the result of filler to those areas. And the biggest issue to my eye is that the filler that may have been placed was built up a little too much medially, so closer to the center of the face, as opposed to being spread out more evenly across the cheek. And even better would have been more emphasis on the lateral cheek. But because the medial face was built up more, you can really spot a very obvious difference compared to years prior. And even when you look back at Jim Carrey at age 19, there's a bit more of a balance in the degree of fullness across the cheek. It's not so heavily centered just on the medial cheek itself. But with the addition of what I think is filler, there's now a lot more attention on this area here. And in 2026, at the age of 64, to me, it looks like there have been some additional changes to Jim Carrey's face. I think that there are signs of a brow lift. When you look at his hairline, it appears to be higher, and that's sometimes what a brow lift leads to. In addition to the scarring that you might have from a brow lift, it can also increase the top third of the face as the hairline is brought up. And of course, it could be just a sign of aging, but for him to have a fairly fixed hairline for so many years and then just kind of overnight have a higher hairline is just unlikely. So that to me also just indicates that this may have been a brow lift. And the brows just look more lifted. The eyes look more open, the brows look more lifted compared to even him at age 19. In addition to the brow lift, I think he may have had an upper blepharoplasty. This is because I'm seeing some increased supratarsal show, and again, his eyes appear more open than they did in previous years. Look at his smile here at age 64 and compare that back to age 19. You can see that things look more open than they ever did for him. Also, I think that Jim Carrey may have had a facelift with or without a fat transfer. Look how smooth his jawline appears now. Also, to my eye, it looks like the sideburns have shifted up. And that level of distortion is what we see with some facelifts, where sometimes the tragus appears flatter and larger, sometimes the sideburn is pretty much taken off with that lift. And some patients actually come to me for a hair transplant after a facelift to try to restore their sideburns and to cover up some of the scarring with hair. Remember, with a hair transplant, it's not just the masking of the scar with hair, it's also the remodeling of the scar that we see once those hairs are growing in the scar. All that new blood flow to the scar leads to an improvement in the quality of it. So that's something to keep in mind. Also with Jim Carrey, we're seeing that his cheeks now look fuller. So when a facelift is done, the cheeks tend to gain volume, especially in that lateral cheek. He may have also had a fat transfer for even more volume, and his skin quality now looks improved. Remember that with a fat transfer, you're bringing in some fat stem cells, and those stem cells tend to rejuvenate the skin quality. But also with facelifting, sometimes laser resurfacing is performed, sometimes a chemical peel might be performed around the same time to further improve the quality of the skin. The total cost of these potential procedures for Jim Carrey is $165,000.
This video is about Michael Jackson and his nasal surgeries.
Hey, Looney Tunes! This is what Michael Jackson looks like. You look like a big fat mental patient.
You'd be amazed how often I hear that.
As a rhinoplasty surgeon, I feel a lot of heavy weight on my shoulders talking about this topic. Michael Jackson, king of pop, was an incredible inspiration and continues to be for so many people. He was kind of this larger than life person, just appeared, in his prime to be kind of this unstoppable, everlasting type of individual. And yet we all kind of started to realize at some point that he was fighting many demons and had a lot of kind of complexities in his life. So this video is not meant to ridicule Michael Jackson, his decisions about surgery, or any of his doctors who took care of him. It's really meant to be a case study into rhinoplasty surgery, things that can go wrong, how we sometimes look to improve on those things, and also kind of reasons why, why he may have gone down this route of having had many, many, many surgeries. And so keep watching, and I'll be talking about how many surgeries, rhinoplasty surgeries in particular, I think Michael Jackson had, as well as sort of the reasons as to why he may have done that. So starting out with his first surgery, which seems to have been in 1979. He was 21 years old at this time. And then a little backstory from what I read is that he actually had an injury during rehearsal and hit his nose, and apparently that was what mainly led to him wanting to get the first rhinoplasty. And I believe this in part. I think there was definitely a cosmetic component to the surgery, but perhaps he did have some functional issues such as breathing problems through his nose as well. So looking at the two images side by side from 1975 to then 1979, what I'm seeing is that it looks like he had an alarplasty performed, which is a procedure around the base of the nose, and that's to reduce the width of the base. He also had some increased projection added to his dorsum, which is also called the bridge, as well as some tip grafting in the tip of his nose for added projection, and it looks like overall sort of a thinner appearance. In general, as you add some substance to the bridge and to the tip, you get a narrowing effect. It's almost like a tent pole. As you raise that pole up, the base of that tent narrows. So it's the same thing with the nose. Again, Michael said that this was to help him breathe better.
I've had no plastic surgery on my face, just my nose. It helped me breathe better so I can hit higher notes.
Potentially, he did breathe better after the surgery. It is possible because his alar base, or the base of his nose, doesn't appear to be too narrowed. And with that increased projection, it's possible that he may have had some improvement in his breathing. He may have also had some septal deviation, perhaps, that was corrected. That's the central partition of the nose. And maybe if that was deviated to begin with, if he had that corrected, he could have been doing better. So we talked about also the tripod theory of the nose. Looking at surgery number 2, this appeared to be in 1983, or around that time. And now with this second rhinoplasty surgery, it looks like the tip and the bridge were further narrowed and further refined. It still looks natural, still looks relatively acceptable, I would say, for his face, but he's already starting to have some loss of lateral nasal support. And you can see these depressions, or like a groove forming at the what's called the supraalar crease. It's this crease on top of the ala, which is the side piece of the nose. This little groove that's forming on top, and it's as you'll see with the subsequent surgeries, it gets deeper and deeper. And that's because there's work being done to remove this cartilage on the inside of his nose, and that leads to loss of support. He's also developing what looks like kind of a button nose, where there's this pinching of the lower lateral cartilages in this portion of the nose. And so instead of kind of maintaining some natural divergence of those cartilages, whoever did a surgery basically just mashed them together and combined them and just stuck them together with some sutures, and that gives this kind of button appearance, which some people like, but it kind of loses its naturalness. There's a quote here from Dr. Stephen Hoffman, who apparently was, at least for some of Michael's surgeries, his plastic surgeon, who said that the second nose job left him with breathing difficulties and required further work. And we can see why. As you remove the cartilage of the lateral nasal wall and you get those depressions on the outside, on the inside there's a kind of at least a partial collapse of the side wall of the nose. So there isn't enough stenting it open, and that reduces the airflow through the nose. And then in 1984, that's when Michael Jackson sustained scalp burns during a Pepsi commercial. And many think that then led to him getting additional surgeries, not just for the burns, but kind of more cosmetic surgeries as well. And it's interesting when you compare it to this graph that I found, where it kind of tracks Michael Jackson's progression in terms of his highlights and low points throughout his career, not related to surgery, but just overall career. You can see that in 1983, at the height of Thriller, I mean, that was the highest point of his career, most success, just doing extremely well at that time. And then the burning of the hair in 1984 started to kind of take a turn for the worse in terms of his overall kind of trajectory. And then of course he had a comeback, and then overall things started to fizzle out some. And I think that this trajectory of his career also then impacted the frequency and types of surgeries that he had, including on his nose. Surgery number 3, so third nasal surgery for Michael Jackson, third rhinoplasty, looks like it was approximately 1986. And you can see a clear change here from 1984 to 1986 with continued lateral wall collapse. Really at this point, I think it was unlikely that this was helping his breathing, and I think really causing a deterioration in his nasal breathing. And you can just see that the entire external nasal valve is just getting smaller and smaller and smaller. Basically, the opening to the nose is just shrinking down. The capability of getting good airflow is dwindling as well. And then I think from 1986 to 1993, he had a series of rhinoplasties. It's hard to pinpoint exactly which year or which month they were done, but I think he had his 4th to 6th rhinoplasties in that time span, 1986 and 1993. And he probably had additional touch-ups beyond that, but that's my kind of best guess as to how many he had in that time span. And there were no major sort of radical changes during this time. You can see here from 1985 to 88 to 89 to 1992, you still kind of have this projected dorsum, meaning it's not collapsed yet. You have a narrowed kind of dorsum. It's narrow, but it's kind of stable in terms of how it's narrowed. And then the tip is more or less looking similar. So I think maybe there were a few touch-ups in this time span, but no major changes. And then surgery number 7, 7th rhinoplasty in 1994. You can see a clear change here. There's increased rotation of the nose, and that's this way. So increasing the rotation will bring the tip of the nose up. Decreasing rotation brings the tip down. Projection is out further from the face, and deprojection is closer to the face. So it looks like here Michael had an increased rotation to his nose. It also just appears even more narrow and even more pointy at the tip and the bridge. So further narrowing of the bridge, further narrowing of the tip, and an elevation or rotation of the tip as well. 1995 is when I believe Michael had an 8th rhinoplasty surgery. When you look at these pictures from 1992 to 1995, you're seeing this further narrowing as much as is possible to give him a little tiny tip to the nose, keeping the bridge as narrow as possible, this extreme sort of button nose type of situation, and really complete loss of it, the entire lateral wall of the nose. It's almost like it doesn't exist. It almost goes from the cheek into the bridge without any transition. And you know, there are other changes occurring with Michael's face, of course, at this time. That's not the focus of this video, but there are a lot of changes with his hair. There are a lot of changes with the color of his skin, and you know, his vitiligo situation and potential bleaching of the skin. A lot of eye surgery changes, jaw surgeries, cheek implants, the lips narrowing down. I mean, there's a lot of stuff going on, but we're going to continue to focus on the nose. In 2000, I think Michael Jackson had a 9th rhinoplasty. And at this point, if you look at the difference between 1996 and 2000, you can see that the bridge, the dorsum, has really started to cave in. Eventually, you know, you mess around enough with the nose and it's just going to give up. It's not going to be able to maintain that support. The skin is going to get really thin. And it looks like he started to saddle, and that's called a saddle nose deformity. And the base here looks even more reduced when it's almost like there's no air coming in through the nose. The bridge has sunken in and you're just kind of left looking at his tip. And then between 2001 to 2002, what I think happened, and also based on what I've read on the web from some of his doctors from the past, is that he may have had filler placed into the nose. Most likely a hyaluronic acid-based filler. They were starting to get popular around that time. That was a little bit early for HA fillers, but they existed, and I think that was used to kind of build up the bridge. I think he was hopefully advised at this point to really slow down with the nasal surgeries, that potentially they could cost him the entire skin of the nose. If the skin of the nose goes, then you need skin grafting. That becomes a very big undertaking. I don't see obvious evidence that Michael had skin grafting, or what we sometimes do, which is a rotational flap down from the forehead, actually, to bring healthy skin onto the nose if that skin fails. I don't really see any obvious signs of that, but I think he did have filler placed, at least into the bridge of the nose, maybe into the tip as well. And we'll play a clip here from 2003 when Michael was interviewed about potentially having had plastic surgeries, and this was his response. He says, "I've had no plastic surgery on my face.
Just my nose. It helped me breathe better so I can hit higher notes."
I would have believed that potentially back in the 80s when he had, or I should say 1979 when he had his first surgery. But based on what I'm seeing, you know, after 9 surgeries, I really don't think that he was breathing any better than his original nose. And then in 2005, it appears that he may have had a 10th rhinoplasty with a focus on rebuilding the bridge and the tip. I think this is potentially beyond just filler. I think he did try to have another procedure, and at this point they may have used even rib cartilage to help reconstruct the nose. So overall, I think he's had at least 10 rhinoplasty surgeries. And you know, after you have many of these surgeries, I kind of alluded to this earlier, but the skin of the nose starts to suffer. Your ability to really create something stable and solid from a functional standpoint really starts to diminish. And the appearance, you know, really has diminishing returns after this many surgeries. And so then we come to, you know, why did Michael Jackson have all these nose surgeries?
Why? 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 Why?
And just to start with a quote from, again, Dr. Hoffman, Michael's surgeon. In 2001, he made this quote. He said, "My job is to try to make people happy. In the case of high-level entertainers, the result may not be what the average person would want. But remember, these are performers who want to create a certain image for a special reason." Right? So the question is, what was the special reason? I mean, clearly, Michael Jackson had body dysmorphic disorder, but there was something beyond that, right? There was something driving him to specifically have all of these nasal surgeries and all these additional changes to his face. And to me, it's interesting to speculate on why. And when patients come to me asking for a nose job or a facelift or a lip surgery, it's good to kind of feel out like what is the underlying reason. Why do they want to have this done? How long have they been thinking about this? Because the last thing I want to do is to operate on someone and have them regret having the surgery, or potentially, regret doing it in myself. So sometimes it's good to ask why. And so, now we have a little bit more insight into, Michael's life and reasons why. So 3 different potential reasons as to why I think he had it. And maybe it was a combination of all these things. I don't know for sure. I think one is his battle with vitiligo, which is an autoimmune condition. And as you guys know, I have my own autoimmune condition, alopecia areata, which destroys hair follicles. In vitiligo, the body is actually attacking the pigment in the skin. And so you start to lose some of the pigment, and you get these like little areas of pigment loss, and eventually it can kind of spread all over. And so I think Michael was battling this condition, this autoimmune type of condition, and it was kind of, making him look more and more white. And I think at some point he probably did some bleaching to kind of even out the tone. And you can see signs of, the hair getting straighter, certain features like the lips getting thinner, the nose getting more narrow and projected, certain Caucasian features that he was taking on. And maybe he felt that he kind of had to go sort of all the way to, satisfy that kind of transformation, which was partially out of his control, of course. Number 2 is, I think he potentially wanted to be less like his family. He talked openly about how he would get, laughed at, made fun of by his brothers. He had a very tumultuous relationship with his father.
He practiced us with a belt in his hand. And if you miss a step, expect to be...
And maybe this was kind of like an FU to his family, to say, I'm going to be different and I'm going to just do whatever the hell I want to do. And then number 3, which I find to be the most intriguing explanation, is that he actually was enamored by the character of Peter Pan. And as you guys know, he built out this Neverland, almost like a theme park, which was, I guess, part of his house and whatnot, and kind of shared it with a lot of children, and, had, that whole thing going on. And to him, I think Peter Pan was like a representation of youth, and it was the youth that was stolen from him when he was a child and was essentially forced to perform. So I think he wanted to kind of relive that youth, and he wanted to be more like Peter Pan.
Peter Pan, to me, represents something that's very special in my heart. He represents youth, childhood, never growing up, magic, flying, everything I think that children and wonderment and magic, what it's all about. And to me, I just have never, ever grown out of loving that or thinking that is very special.
Do you identify with him?
Totally.
You don't want to grow up?
No, I am Peter Pan.
No, you're not. You're Michael Jackson.
I'm Peter Pan in my heart.
And if you look at an image of Peter Pan, and you look at the nose, and you look at that sunken in bridge, and you look at that upturned tip, that narrow tip, and even the way the eyes are shaped and the mouth is shaped, you start to really see, what maybe Michael was striving for. And Michael once said, "I'm never pleased with anything. I'm a perfectionist. It's part of who I am." So I think part of what drove him and what inspired him to continue to create all this incredible music and perfect his dance moves and all this, beautiful stuff that he brought into the world was probably some of the same tendencies that also drove him to do all these surgeries.
Throughout his long and distinguished career from senator to president, Joe Biden has undergone a remarkable journey. From his early days as a young senator to his current role as the leader of the free world, Joe Biden's face and hair evolution has sparked quite a bit of curiosity. Has he remained all natural amidst being in the spotlight for 5 decades, or has he had plastic surgery at some point over the years? Today, we'll explore Joe Biden's transformation and examine any possible procedures he may have had along the way. Stay tuned for the cost of these potential procedures at the end. In 1965, at the age of 23, you can see that Joe's hairline has already started to push back. He has some frontotemporal recession. And you can see the degree of recession when you compare back to when he was 9 years old. Joe's brows appear flat and they're resting right on the brow ridge. He has a flat nasal tip cartilage appearance and he has no bulbosity to the tip of his nose. He also has full upper tooth show on smile, and you can really appreciate the strong jaw structure that Joe Biden has. In 1968, at the age of 26, now Joe Biden has a Norwood 2 type of hair loss. And this would have been the time to start on medical therapy, such as on finasteride and minoxidil. Though keep in mind that those two medications were not available until the 1990s. To find out more about that medical therapy, along with other things that you can do to improve the state of your hair, head to feelconfident.com. In 1972, at the age of 30, this is when Joe Biden first became senator. And you can see that his hair is now at a Norwood 3. And notice also that the temples are almost gone. He also appears to have static forehead rhytids and some under eye hollowing. In addition to his nasal tip cartilage not being bulbous, it does happen to be cephalically positioned, which means that the lateral crura of the lower lateral cartilages actually points more towards the medial canthus of the eye compared to the lateral canthus of the eye. This type of composition sometimes leads to people not being able to breathe as well through their nose, though that might not be the case with Joe. As you redirect those cartilages out more laterally, you create more airflow through the nose. In 1974, at the age of 32, there is now progressive frontal scalp thinning. And you can see the technique that he's using with his hairstyle, which is to comb the hair over from left to right. That can sometimes give the illusion of more density. In 1975, at the age of 33, now I'm seeing some mid-scalp and crown thinning as well. In 1980, at the age of 38, what you can appreciate here is that Joe Biden has near complete crown loss. So while he still has some hair to comb over in the frontal scalp and the mid-scalp, in the crown area, there really isn't much to work with. In 1983, at the age of 41, there are signs of a potential hair transplant, most likely with plug grafts, most likely to the hairline and the frontal scalp. Punch grafts were done by taking a 4mm punch from the back of the scalp. Usually it had about 20 to 30 hairs per single punch, moving that over to then the frontal scalp. As those were placed, they tended to give a more pluggy appearance or a doll's hair type of appearance, as we showed with Donald Trump's potential hair transplant. And you can see that the temples were left essentially untouched, and that was usually the case with plug grafts, because it was difficult to get the proper angles and to give the refinement necessary to be able to do temple work. Check out our video on Donald Trump to learn more about the plug graft procedure. In 1984, at the age of 42, what you can see from the plug graft procedure is that there are heavy grafts at the hairline and it doesn't look completely natural. We have a video on how to fix a receding hairline that goes in detail about how to create naturality at the hairline. You can also see here that with the aging process, there is now lateral brow descent, and this happens as the tissues lateral to the temporal crest start to weaken and descend with time. There is also dermatochalasis of the upper eyelid, or essentially excess tissue of the upper eyelid that is weighing down over the eyes. In 1987, at the age of 45, what these pictures show us is the importance of the hairline and the forelock for creating the perception of good hair from a frontal view. But my guess is that at this point, he has little to no original hair in the DHT sensitive zone. But just by recreating that little bit of hair right at the front, he looks like a person with hair. Unless, of course, you look from the side view or from behind, then you start to appreciate the hair loss. You can also see that at this point, Joe now has a loss of jawline definition as his neck fullness has increased and the face has started to descend. In 1988, at the age of 46, I wanted to point out here that there is now philtrum lengthening and the lip corners are more downturned. And again, these are just signs of aging as our skin lengthens and it starts to hang down with the effects of gravity and our tissues atrophy and weaken with time. And in 1990, at the age of 48, you can see a very different Joe when you look from the front compared to the side. And the two main reasons for that is that from the front, again, you see that hairline and forelock that's giving us the impression of Joe having good hair. And then also, it's difficult to really tell that there's much laxity in the neck. It looks like his jawline is pretty clean. But as you look from the side view, you can really sense that lack of definition in the jawline and that hair loss that now exists there in the mid-scalp and crown areas. In 1992, at the age of 50, there is now glabellar righted deepening, and his upper eyelids are now starting to potentially obstruct his field of view from what I can see in this photo. And that is sometimes an indication for an upper blepharoplasty that's done for functional purposes, not just for cosmetic indications. In 1993, at the age of 51, I do see some additional hair now at the frontal scalp, and it appears to me to be positioned slightly lower than what I saw previously. This suggests that potentially Joe Biden may have had more plugs placed around this time. Remember that FUT surgery was first described in 1995, and since this is 1993, I don't think he had an FUT at this stage. And in 1994, at the age of 52, since these potential hair transplants have focused on the frontal scalp and hairline, he has now adopted a different type of hairstyle, where he switched from a comb-over type of approach to a comb-back approach in order to make the mid-scalp and crown appear more full, even though they're fairly devoid of hair. In 1995, at the age of 53, there is now some signs of lower eyelid pseudo-herniation, which is like the bulging fat pockets that you sometimes see. And there is continued increased neck laxity that has occurred over time. In 1998, at the age of 56, his hair is looking less pluggy and more full. Now, this might be because of a possible FUT type of hair transplant. Remember that FUT surgery involves taking a strip from the back of the scalp, dissecting it under the microscope into follicular units or small grafts and placing them along the hairline or frontal scalp or wherever you need to increase density. Now, for patients who've previously had plug type of hair transplants, the options for repair or revision work include either removing those plugs and then placing these types of smaller grafts that we do these days, or by working around those plugs and using FUT or FUE technique to extract out grafts and to place them around the plugs to soften the appearance. Now, I'm not sure exactly which type of approach Joe Biden had, but it was most likely one of those two. And most likely the harvesting approach was FUT because, again, FUT was described in 1995, while FUE surgery was described closer to 2002 and became more popularized around 2010. And also, it looks to me like Joe Biden may have had a brow lift around this time. Compare back to the image from 1978, and you can see that there's more infrabrow space. And we have a video that we've done in the past looking at the different techniques for brow lifting, so make sure to check that out. In 1999, at the age of 57, you can see that there is temporal thinning, not of the hair specifically, but of just the temples on the sides of the head. Now, some people choose to get filler into the temples to make them less concave, but there are some concerns there because as you place filler into that delicate area, there are important blood vessels, and if you get filler into a blood vessel, sometimes you can have bad problems, such as even causing blindness, which is rare, but it can happen, so you have to be very careful. Also, as you start to inject filler into the temples, you want to make sure that you're not lateralizing that area any more lateral than the actual cheek. And because as you do that, things start to look very unnatural. So I don't think Joe Biden had any of those procedures at this stage, but I'm just giving you guys some reference points for those types of cosmetic procedures. In 2009, at the age of 67, Joe Biden becomes vice president. And the main aging sign that I'm seeing here is that there is skin laxity in the neck, and we sometimes call this turkey neck. Now, this is difficult to treat non-surgically. There are, of course, some radiofrequency devices that tighten the area, and we've spoken about that in other videos, but there's truly no way to reposition all that tissue because it's extra skin that has sagged down, and there's also some fat there and weakening of muscles. So the two main surgical surgical ways to address it is either through a full facelift neck lift, where you're going to resolve that extra skin and the tightening of the tissues from the inside and resolving that skin laterally. The other option is a direct type of lift of the neck, and that's done right through here. And as you do that, there are of course some visible scars right down the center of the neck, but typically what's used is a Grecian urn type of design to reduce the tension on the area and to make it less obvious once the scars heal. You can go in there, remove some extra skin, extra fat. You can also tighten up the platysma muscle and improve the area. And those are just some of the options that are available for people with a similar type of configuration. In 2012, at the age of 70, while the frontal scalp has hair still, the mid-scalp and the crown are nearly fully bald. And to me, there are some signs of a potential lower blepharoplasty, where those bags, that pseudo-herniation that he had prior, are now less obvious. He has this smoother lower lid to cheek transition, and that makes him look less tired and more youthful. In 2014, at the age of 72, the nasolabial folds have become deeper, and notice how his lips have thinned out with age. We lose things like elastin and collagen as we age, and that is partially what leads to a thinner appearance of the lips. And also notice how the philtrum has lengthened. And as you compare back to Joe Biden at age 23, you can really see these aging-related changes. In 2019, at the age of 77, there are some signs of a facelift and neck lift procedure. Joe has improved jawline definition. He has reduced submental fullness. His midface also appears more elevated. And we do see some scarring around the ears, which is a standard location for facelift procedures. When you're designing incision placement for facelifts in men, one important consideration is whether or not you should go pretragal, which is right in front of the tragus, which is this little piece of cartilage, or if you should go posttragal with your incision. If you go posttragal, which is very common in women, if you do that for men, you're going to essentially pull the beard hair over the tragus. And then you're left with the options of either letting some hair grow out on your tragus, which doesn't look totally natural, or doing something like laser hair removal for those hairs. The advantage of going pretragal is that you get to avoid that type of hair displacement laterally. But sometimes the scar can be in a little bit more of an obvious location. But if you hide it in a fold or a crease right there in front of the tragus, usually the results are just fine. Most of the unsatisfactory scarring that we see with facelift surgery has to do with excess tension that's built into the area. And that's usually from the lack of release of tissues as the facelift is done. In 2020, at the age of 78, again, I'm seeing potential facelift scars in their typical locations. You can also see the portion of the face that appears to actually have been undermined and lifted. You can see how pulled that area seems, and you can almost tell where they finished their dissection medially. It doesn't look like that dissection went all the way towards the nasolabial folds, which is often what's done with a deep plane type of surgery. It looks to me like they had stopped right along the area of the lateral canthus. You can almost tell where that demarcation is. And I'm also seeing on his right side that there is a pixie ear deformity, where the earlobe gets dragged down with the scarring as you heal from a facelift, and you lose that earlobe definition. Instead, it looks like a webbed area there. And that often stems from, again, tension being built up. If you want to reduce tension on your closure, you need to adequately release the tissues, and that is exactly what deep plane surgery is meant to do. So I would guess that Joe Biden did not have a deep plane facelift. It was most likely a SMAS plication or an imbrication. In 2021, at the age of 79, the right pixie ear persists. The submental area is now almost back to where he started. So this brings us to the discussion of the longevity of facelifts and really any type of lift that's done on the body, but especially with facelift surgery. So the most that you can expect to get out of your facelift is maybe 10 to 15 years, but depending on the technique and of course on the patient's anatomy, sometimes a facelift will only last for 6 months to a year, which is of course upsetting to most patients because they typically pay a lot of money, money. They go through a big recovery period. They take a lot of time out of their schedule. But it's important to remember that not all facelifts will last for a decade or more. Usually, the procedures that are done more extensively with solid release of all the ligaments of the face and really a true repositioning of the tissues will lead to a longer lasting outcome. The ones where the skin is just a little bit undermined and released and just a little bit is trimmed down and there isn't as much deep work, those usually will not last as long. The total cost of these potential facial and hair plastic surgeries is $145,000. It's Dr. Gary. I'm a hair transplant surgeon. And I wanted to talk about Justin Bieber. He is an amazing musician, and I play his music in the operating room all the time. We're going to be talking about Justin's hair loss. We're going to be talking about androgenic alopecia, traction alopecia, and what men ought to do when they're in a situation like Justin and starting to see the early signs of hair loss. In 2012, at the age of 18, Justin has a very youthful hair appearance. He's also combing it down, so he has even more coverage, and it just looks like a great head of hair. 2013, at age 19, also you can see just a very, very youthful Norwood 1 type of appearance with very high density at the hairline. The temples are well outlined. He has all this like baby hair, fine hair up front. I mean, it just is very youthful, very framing to his face. 2014, age 20, also similar appearance, not much has changed at this point. 2015, age 21. You can sort of make out there's very early frontotemporal reduction of density, but it's still looking extremely youthful. Age 22 in 2016, also a similar appearance. At age 23 in 2017, I'm seeing the first signs of frontotemporal hair loss, and he's inching towards a Norwood 2, and this appears to me to be an androgenic alopecia type of situation, which is the most common type of hair loss in men, and this is a very common pattern that we see. It typically will start with the frontotemporal areas starting to recede back, starting to thin out, and the entire hairline slowly starting to come up, so you have more forehead showing. Those are the early signs of androgenic alopecia, and that's what we're starting to see with Justin Bieber in 2017. In 2018, at the age of 24, Justin Bieber now has a more defined Norwood 2 type of hair loss pattern. He has more frontotemporal recession. You can see an M-shaped pattern to his hairline. Age 25 in 2019, he has a very similar pattern. Age 26 in 2020, again, something very similar. But in May of 2021, he changed his hairstyle. He changed it to dreadlocks. And so I wanted to take this moment to talk about traction alopecia. This is a type of hair loss that occurs when you put the hair on stretch. You are then causing inflammation to occur at the root, at the follicle of that hair shaft. And when you have this type of inflammation, it can eventually lead to hair loss. So he has to be very careful because he already has those signs of androgenic alopecia that we talked about before. And on top of that, he's adding the insult of traction alopecia, and potentially that can lead to a more accelerated type of hair loss with his condition or his situation. So then in May of 2021, he decides to get rid of the dreadlocks. And this is really interesting here because what I'm seeing when I zoom in on this photo of him just laying here on this couch type thing is that it looks like he's got some concealer going on right at the corners. In the walking image that you see here, the corner looks exposed to me and it doesn't look like there's any concealer there. Whereas in the image of him that he posted on Instagram, I'm seeing a more filled in corner, and when I really zoom in, it doesn't look like there's hair at that corner. It looks like it's some form of a concealer to improve the corner. So now what should Justin do? Aside from trying to avoid those tight hairstyles that we talked about, he has a few options. One is he could do nothing. He can just accept the fact that he's starting to lose some hair and really not do a whole lot about it. That's a reasonable option. Another option is that he can shave his head, and some people choose to go down that route. I think that would be somewhat extreme, given that he has very, very early signs of hair loss. He can also choose to wear a hairpiece, which some people in Hollywood do, but again would be a bit extreme for his type of hair loss and not something that I think he would do for many, many years if he even wanted to go down that route. Lastly, he can go down the route of hair restoration. And with hair restoration, it kind of breaks down into two main types of approaches, right? You have a medical therapy approach and you have a surgical type of approach. And there are a few things in between. There are two primary hair restoration goals. One is to stabilize the hair loss and to enrich the existing hair follicles. And two is to consider augmentation options with, say, concealer, scalp micropigmentation, or even a possible hair transplant. These are not mutually exclusive goals, and they can be combined to deliver the best possible outcome. So let's talk about stabilizing the hair and promoting regrowth of the hair. There is the tried and true method, which is the first line of hair restoration for medical therapy, and that includes Propecia, or the generic form, which is finasteride, and minoxidil, which is sometimes known as Rogaine. Rogaine is the topical, but minoxidil comes as a topical or an oral formulation, as you guys know from our minoxidil video. The second line treatments would be something like microneedling, it would be PRP, which is platelet-rich plasma, laser caps, and biotin-based vitamins. That would be second line, but the first line is what I always tell people. It's going to be the Propecia and the minoxidil. Some people choose not to take some of these medications because of side effect profiles, and I respect that. And then we'll go into the second line of treatments when that's the situation. As far as augmentation goes, there's a concealer option. These are keratin fibers that have different colors to them. They're actual keratin proteins that are colored, and they can blend undetectably with existing hair. And you can kind of instantly create the appearance of a more natural type of thicker, fuller hair. Another augmentation option for the hair is scalp micropigmentation, or sometimes known as SMP. This uses ink to temporarily mark the skin, so it's almost like a temporary type of tattoo. It doesn't go as deep as a tattoo does, and it gives the illusion of some hair. It is two-dimensional, so it doesn't look as realistic as actual hair. It also will reduce, hopefully, the scalp shine through that some people have. It also slowly fades over time. It may not completely go away. That's something to keep in mind, and the color might change over time. There are multiple sessions that are usually done for scalp micropigmentation, and then we have, of course, the hair transplant augmentation option. There are different types of hair transplants, as we talk about on this channel. It's important to budget the hair that you have. There is a finite donor supply of hair that we all have on the back of the scalp, side of the scalp, and then of course there are some other donor sites like the neck, like the chest and the back, but they're never going to be as great as scalp hair, as we talk about in other videos of ours. And so it's all about trying to figure out how much hair is needed at the recipient area and how much hair you have at the donor area. It's that equation that we're constantly juggling. And there are two basic types of extraction methods, FUE and FUT, and we've done videos talking about each type and the pros and cons. For Justin Bieber, what would I do if he came to the office and said, I'm looking for a hair transplant at this stage? I would make sure, first of all, that he's on medical therapy to reduce the progression of his hair loss. That's very important. And I would offer him a procedure that would be on the conservative end, because he doesn't have a ton of recession, and he overall has pretty good hair fullness in the mid-scalp and crown. So I would go with a procedure of about 1,200 to 1,400 FUE grafts to the frontotemporal areas and to the temples to bring them forward and reduce that scalloping appearance of the temples, and to just better reframe his face. And we would do a donor shave approach where, since he's already used to short hairstyles, I would just shave the back to allow us to then get the grafts. I do prefer shaving the back of the head compared to doing a no shave technique, because I feel like my distribution of the FUE harvest is a bit more balanced and properly distributed, and I think that's important. So that's the way that I would approach Justin Bieber's hair if he wanted to go down the hair transplant route. But of course, he doesn't need a transplant. No one needs a transplant. It might just be something that he one day decides on, like many other celebrities have.
How much did it cost Elon to get these surgeries? Again, not that it's an issue at all for him. He's like one of the richest people in the world right now. But, you know, I think if you estimate cost. Hey guys, Dr. Gary here. I'm a double board certified facial plastics and hair restoration surgeon, and I happen to have alopecia areata, which is why my head looks like this. So before you go and comment about, you know, the surgeon needs new hair and all this stuff, I do have an autoimmune condition, and we talk about it on the channel. So today's video is about Elon Musk, who is sort of like my idol, and you know, many of us look up to him and all the stuff that he's been able to achieve through SpaceX, Tesla, Neuralink, all the solar power stuff he's working on. It's really, and batteries, all this stuff, it's really incredible. So I hope to do this video justice with how I react to his hair and what I think he's had done, and I hope that it helps other people out there who are maybe considering a hair transplant or just curious as to how his hair looks so amazing now, considering how he looked back in the 90s, for example, right? So when he was with PayPal, you can see pretty significant frontal thinning and out into the mid-scalp. He was in his late 20s at this point. It looks like his crown was still maintained at this point, and he otherwise has pretty good thickness to his hair and pretty good density in the kind of general donor type of zone. I guess he got tired of this look and was trying to, you know, get some additional hair. He most likely was on medical therapy around this time or maybe soon after this time. My guess is he probably went with FDA approved types of treatments such as finasteride and minoxidil. That's the most likely thing. And then we see him in early 2000s, in like 2003, at age, say 32 here, and he has got much better hair in the frontal mid-scalp. So could he have achieved this with just medical therapy alone? I think it's unlikely. It's possible, but I think it's unlikely. And I think in this interval, he had a hair transplant, his first hair transplant, likely with an FUT type of approach, which is the strip type of scar that comes from the back of the head, as opposed to FUE. At that time, in the early 2000s, that was sort of the most prevalent way to get a hair transplant, which is what with the strip approach. So I think he probably had a shorter strip at that time point, maybe about 2,000 up to maybe 2,500 grafts. Definitely made an impact. But when you look closely, there's still kind of a lower density sort of appearance at the frontal scalp, and it just doesn't look like it fits in with his donor zone in terms of the density of hair. Then it looks like he went through another hair transplant, again with FUT, and this is the time that I think he had that really kind of long scar type of strip procedure. And you can see that there are a couple of examples that we're going to flash up here, where you can see from a profile view there's clearly a sign of a scar kind of starting all the way up here at his frontotemporal angle and running down into the safe donor zone underneath his crown and to the other side. There was also an interview that he did on CBS that's really kind of showing that strip scar. You can just see the thinner hair in that area, and you don't really see any kind of thinness throughout the rest of the donor area. So I don't think he's had an FUE procedure. I think he's had 2 FUT procedures. So then after the second transplant, which looks like it was maybe around like late 2000s, maybe around 2009 or so, is when it seems like he had his second procedure. And then you start to see a much more robust frontal and mid-scalp with really solid density, almost rivaling his original hair. A really, really nice job. With this second procedure, because of how long they went, they probably incorporated the original scar in that second FUT. My guess is that he had an additional 2,500, maybe even 3,000 grafts to the area. So that is definitely impressive. sensitive. And now you can see, I mean, he's working with a great head of hair. And I think he naturally just happens to have good fill into his crown, and I think he's probably still on medical therapy to help to protect the hair, his original hair. Because as I kind of refer to this in some videos, it's kind of like if you're not on medical therapy when you get a transplant, assuming you still have some pre-existing hairs when you get the transplants, it's almost like dumping sand into a bucket with a hole at the bottom. You're putting in grafts and a bunch are spilling out. So it's good to be on medical therapy if you have pre-existing hair after transplants to, again, protect those hairs that are DHT sensitive, right? That is what I think went on, and that's why Elon Musk's hair looks as amazing as it does. I don't think he had FUE. FUE became more popular after about 2010, and he would have had a kind of a thinner look based on the number of grafts he had to achieve the type of look he did at the recipient area, and all of that FUE harvesting would have made a bigger sort of impact on the thinness of the back of his scalp, where in my opinion it looks really thick. It's just that he has that long scar. So that again kind of speaks to the advantages of FUT versus FUE. FUT, you can really get more grafts out of it than FUE over like the entire sort of lifespan of harvesting. Something closer to, say, sometimes upwards of like 6,000, 6,500 grafts, whereas with FUE, you're looking at maybe 5,000 grafts, maybe 5,500, depending on your starting density and scalp size. So for someone looking to maximize the number of grafts that they get over, the course of all the time that they can get these procedures, you really want to consider FUT. Again, a lot of my male patients, they don't want to do this because then they can't wear their hair short. And as you can see, Elon, when a camera hits him at certain angles, certain different types of light conditions, you can start to see that scarring coming through. You can get SMP or scalp micropigmentation into the scar, but it's easier to do SMP into FUE scars than it is into an FUT scar to make it look more presentable and sort of cover up the scarring later on. So again, I think knowing sort of what we know about Elon and how big he likes to go, right, with his companies, with like kind of putting everything on the line, I think he probably sort of went big and had 2 sizable FUT procedures that have again resulted in an excellent outcome. Really beautiful result, very naturally done hairline, just excellent work. I don't know where he went, but he obviously went to some of the best surgeons that you can find. And that brings us to cost, right? So how much did it cost Elon to get these surgeries? Again, not that it's an issue at all for him. He's like one of the richest people in the world right now. But, I think if you estimate cost with his first FUT procedure, if you consider about 2,000 to 2,500 grafts, the top clinics, the most expensive clinics that have very strong reputations over the last few decades worldwide. I mean, they're charging upwards of either $25,000 for a case, no matter the size sometimes, or something like $10 a graft. If you look at that, I think he's probably spent close to $20,000 to $25,000 for his first surgery, and then probably something similar to that with his second surgery. So that'll put us at about, say, $50,000 for Elon Musk. He isn't going to feel the impact of that cost, but for most everyone else, I mean, it's a big expenditure, and you really want to make sure that it's worth it, right, after going through all that and spending all that money. So for him, it clearly was. Everyone has to kind of make their own decisions on surgery, if surgery is right for them, and my videos are really meant to just educate the public so you can make an informed decision, whether that's for surgery or against surgery.
Known for his striking looks and undeniable charisma, Henry Cavill has become a household name, leaving fans mesmerized by his on-screen performances and, of course, his ever-evolving appearance. From his days as Superman to his recent film Argylle, we'll explore the subtle changes and possible enhancements that have led some to speculate about the possibility of plastic surgery. In 2002, at the age of 19, you can see that Henry has a slight widow's peak. He also has full eyebrows that are horizontal in nature, and as we know, this is a very masculine type of trait. Henry has a prominent mandible, and he has very strong mental tubercles. Just like we have tubercles in our lips, as I've pointed out in many other videos, we also have these different prominences in different parts of our bony structure. This is different from a dimpling in the chin, which is usually caused by a dehiscence of the actual muscle that lives in that area. Here we have prominent bony prominences just lateral to that mentalis muscle. He also has full tooth show when he smiles. Jumping ahead to 2007, where he's 24 years old. What you see here are forehead rhytids or wrinkles, and this is caused by the frontalis muscle. The wrinkles always run perpendicular to the underlying muscle. The frontalis muscle runs in this direction, so then the lines that you see on the skin surface are going to be horizontal in nature. Some people start Botox injections in their 20s and 30s as a form of prejuvenation, where they're trying to delay the onset of deeper wrinkles. Prejuvenation with Botox is a very different use case compared to filler injections. With filler injections, there's nothing preventative about it. You're only using it to cover up signs of aging that have already presented, or adjusting a certain anatomical feature that maybe you're not completely fond of. You can also see that Henry has tear troughs present. The left side is a bit more pronounced than the right. This is also called infraorbital hollowing, and it's something that most of us develop over time. Keep in mind that lighting has a strong impact on how our infraorbital hollowing appears. Even when we shoot these types of videos, we have a light that's directly facing me so that my infraorbital hollowing is not as obvious. Here's what happens when we turn those lights off. So now that the overhead light has been turned on and the lights facing me have been turned off, you can see that the infraorbital hollowing is a lot more obvious, and this will impact how Henry appears in various photographs that are taken of him, as it applies to everybody else. Henry also has good definition to his Cupid's bow, and this is an area that's very difficult to adjust. Some people ask me if there's a surgery that can better define their Cupid's bow area. The truth is there really is no surgery for that. Sometimes people use filler to try to adjust some of the contours of the Cupid's bow, but that does run the risk of looking somewhat artificial. Henry also has a similar volume between his upper and lower red lips. It's about a 1-to-1 ratio. In 2008, at the age of 25, Henry has a Norwood 2 type of hairline. He has that slight frontotemporal recession in the corners, but he does have preserved anterior temporal peaks. And keep in mind that when we talk about the forehead dimensions, it's not just how high up the hairline actually starts, it's also the projection anteriorly. So if you have an expansion of your forehead that goes up and goes out to the side, that's when the forehead starts to look bigger. And one of the ways that you can get that expansion laterally is with the temporal peaks starting to recede, as well as the frontotemporal areas. So when people come to my surgical practice looking for restoration of their hairline, one of the discussion points becomes, do we adjust anything with the temples or do we leave them alone? And that's something that we assess on a very case-by-case basis. Keep in mind that adding grafts to the temporal area does consume quite a bit of your donor supply, so we need to make sure that that's a good investment of grafts. Henry here has those low masculine eyebrows. When I look at his nose, what I see jump out at me the most is that he has a prominence to his left nasal bone. Remember that the upper part of the nose along the bridge is going to be your nasal bones. That's an actual bone, right? There's two nasal bones and they're joined right at the center. As you travel further down the bridge of the nose, that becomes cartilage. Even though it feels like hard bone, it's actually cartilage that you're feeling lower down on your bridge. When I look at Henry's nose, that left nasal bone to me looks like it kind of jets out, and it appears that way through the years. Henry has a strong jawline. That's one of his distinguishing features, and this is from a combination of different elements, which include the mandible size itself, the hyoid bone positioning, as well as the amount of submental fat. All of those things need to align in order to give you that very sharp type of jawline with the prominence that you see here. Let's say, for example, if his mandible was of a similar size and his hyoid bone was still well positioned, but he had that extra submental fat. Now all of a sudden that contour would really change. Similarly, if he had a smaller mandible but a well-positioned hyoid bone and very little submental fat, it again would not look like it does in his case. So all three of those elements need to essentially align to give you this type of appearance. In 2009, at the age of 26, I see no change. In 2011, at the age of 28, I wanted to point out here that Henry's eyes are not the same. He has what's called segmental heterochromia. You can see a patch of brown in his left iris, but otherwise his eyes are blue. This is a phenomenon that's much more common in cats and dogs, but it's rare in humans. Most people are born with this trait, but some people can get it from injury or from illness. I think that this feature is inconsequential to his overall appearance, but it's something worth noting and something that's interesting to learn about. In 2012, at the age of 29, I see no change. In 2013, at the age of 30, Superman is now approaching a Norwood 3 type of hairline. You can see deeper frontotemporal recession, and now because of that, his widow's peak is even more pronounced. But his temples are still intact, and that again reduces the width of his forehead, even though the vertical axis is increasing in forehead size. Many patients come to me with this type of hairline configuration and they're looking for surgical enhancement to the hairline. But the most important thing with this type of appearance is actually to preserve it, because you can see in Henry's case and in many of my patients, there's still excellent hair in the frontal scalp, mid-scalp, crown, in those DHT sensitive areas. And the key is to protect that hair. It's much more important to do that than to actually get a hair transplant. A hair transplant can adjust some of the contours of the hairline, sure, but really the most important thing with this type of appearance at age 30, like Henry is here, is to protect the existing hair. And we talk about that a lot on the channel, and we have medications available for that purpose at feelconfident.com. In 2014, at the age of 31, you can see that Henry has now more prominence to his nasolabial folds. This is something that happens to all of us as we age, and it's not an area that we should constantly look to fill. Henry still has a nicely preserved neckline. And I don't think this is because he's been mewing. This is of course mostly due to his incredible genetics, and it's also coupled with proper dieting that helps maintain that neckline. In 2015, at the age of 32, Henry has this excellent beard. It's slightly more patchy on the left-hand side, and the cheek height level is slightly lower on the left than it is on the right. And these types of asymmetries are very normal when it comes to facial structure. He overall has a very symmetrical face, but this is one asymmetry that I noticed. And again, these types of asymmetry are what actually add to a person's attractiveness, whether you're a man or a woman. In 2016, at the age of 33, what I'm seeing here is that Henry has these bony changes, but I think they're likely due to weight loss rather than different types of injectables or buccal fat removal. I just think that most of this can be attributed to various changes in his weight, because you see it reverse later on as well. So it's not just his cheeks that narrow in as he loses weight, it's also the area around the eyes. That starts to look more hollow. And that is what happens as we lose weight or as we gain weight. Then you expect a more global change in the face, not just in any one area. And so it was interesting to learn that Henry was actually teased in private school for his weight. They used to call me Fat Cavill, Henry told Men's Fitness in 2015. I actually had rolls of fat on me, he said. These early experiences of course shape who we become and how we treat ourselves and our bodies over time. I have this video about proving haters wrong where I go through some of my life experiences and how that shaped who I've become. So make sure to check out that video if you're interested. In 2017, at the age of 34, I see no change, and that's the same through 2019. In 2021, now at the age of 38, again, it looks to me like not much has changed, down to the exact upper lid creases that he had before. I've looked through many pictures, and it just seems to me like not much is changing other than the natural aging process taking its course. In 2022 and 2023, I see no change. In 2024, age 40, all I'm seeing here is more upper eyelid hooding. This, I think, is a combination of dermatochalasis, where our upper eyelid skin gets a bit more baggy, as well as lateral eyebrow descent. Those two things are usually what account for a more hooded upper eyelid appearance. I think he looks quite natural and very youthful for his age. Today we'll take a look at David Beckham's hair throughout the years, and we'll see what he's done to try to combat hair loss. 1996, at the age of 21, you can see that David has a prominent widow's peak. He also has good facial proportions where the horizontal thirds are just about equal. Top third is about the same as the middle third and is about the same as the bottom third. In 1997, at the age of 22, I don't see any major changes. Same goes with 1998 and 99. In the year 2000, at the age of 25, what I'm seeing here is an interesting type of phenomenon. He has this horizontal bony prominence right at the coronal suture line. This is interesting. It looks like it might be a mild or late form of craniosynostosis, which is fusion of the cranial bones. This is not the most common thing to see in adults, but something that it looks like David has. It doesn't really have to do with hair loss, but I figured I'd bring it up. He has early signs of frontotemporal recession that you can see in these photos, and you can see more of a scalloping on his right side compared to the left side. In 2001, at the age of 26, there are no changes. 2002, all I'm seeing is a really cool haircut. 2003, also no obvious changes noted. In 2004, at the age of 29, I'm not seeing any obvious change, and there are no signs of any transplant surgery as far as I can tell from the donor area. In 2004, it would have likely been an FUT approach, if any, given the popularity of that type of transplant at the time. But again, for David Beckham, I don't see any signs of it at that stage. 2005, age 30, no changes. Same in 2006, 2007, and in 2008, at the age of 33, I'm pretty sure that by this time, David Beckham is likely on some medical therapy, and we talk a lot about that on this channel. But essentially what I recommend is dual modality therapy, and most patients start with a first-line type of treatment, which is Propecia, the generic of which is finasteride, as well as minoxidil. As you guys probably know from my minoxidil video, there is a topical formulation which is Rogaine, but it's also available as an oral form, which is minoxidil, taken as a pill once a day. Usually for most of my patients I recommend finasteride as a pill and minoxidil as a pill, each taken once a day. So my guess is that David Beckham is likely on a combination of those medications. He might also be using a laser light cap, maybe some microneedling, and maybe he was getting PRP as well. But the first line medical therapy for hair loss in men for androgenic alopecia is finasteride and minoxidil. In 2009, at the age of 34, I'm not seeing any major change. 2010, 2011 and 2012, also no real changes. In 2013, at the age of 38, when I look here at his left temple, I'm seeing the use of some degree of camouflage. So he might be just having like some makeup done for his photo shoot, or he may have just been using fibers there, but it looks like when you compare the left temple to what came before it and also what comes after, you can see a return to baseline that comes after this year. So in 2014, already you're not seeing that camouflage on the temple. 2014, no obvious changes. 2015, at the age of 40, no change. 2016, at the age of 41, still I'm not seeing any signs of a transplant. But what this photo really shows well is that the first few rows of hair, normally in natural hairlines, has finer hairs, and we try to recreate that with a hair transplant. The way we do that is to put single hair grafts right at the hairline for the first 2 to 3 rows, and that is important because you can see in David's hairline how he has these finer hairs for like almost like the first 5 millimeters to a centimeter, and then it starts to blend into thicker hairs. And he might also be using most likely some fibers here, but still there's this natural progression, and that gives it a naturalness, and we try to recreate that with surgery. Also, you can appreciate with with David Beckham's hairline here, how there's an irregularity to the hairline, and there is both a quality to this where there are micro irregularities and macro irregularities. So there is kind of the sawtooth type of appearance, and then even in areas where it's more straight, you can see that there are hairs that are more irregularly placed. So there's micro and macro irregularity. 2017, at the age of 42, what I'm seeing here is that the frontotemporal recession continues, especially on the right hand side. And when you compare back to 2001, and if you look right at his birthmark there on the right temple, you can see that it used to be covered more with hair, and now in 2017 there really isn't as much hair in that area, and that signals additional progression of hair loss, but it overall is still remarkably stable at the age of 42. 2018, at the age of 43, you can see that David is starting to close down the corners here by using what seems to be the posterior temporal hairs. So as he combs those forward or combs some of his lateral frontotemporal hairs down, that helps to camouflage or close down the corners so it doesn't look as recessed. And in 2019, at the age of 44, what I'm seeing here in this image is that he's using fibers to also close down the corners. So you can see in the right corner here how it has a more of a rounded and more well-framed appearance because of the use of that camouflage. And you can really see it here and how distinct it is from the surrounding hair. It's especially obvious here because he doesn't have much hair to cover it. As he uses the camouflage throughout the rest of the scalp, he has enough hair in the area to make the whole appearance just look thicker, but so that you can't really tell that much fiber or camouflage was used. And in 2020, at the age of 45, there was this one image in particular that was released in the tabloids, and it shows basically that David has a short haircut, and because he's right under the sun, it's exposing some of the transparency and some of the scalp show, and you can really appreciate the difference in hair density between the DHT sensitive area, which is this whole bit throughout here, and the DHT resistant zones, which lines the side of the head and the back. But I don't think that he's had a hair transplant as far as I can tell. It looks like as he grows his hair out, he's overall showing then thicker, healthier hair, and then he's able to use the fibers to further increase the appearance of density. In 2021, at the age of 46, he's had the continued use here of fibers, and again he's using the surrounding hair to further conceal the recessed corners. 2022, I'm not seeing any further change for David Beckham's hair.
While rumors about Bradley Cooper's appearance have circulated for years, a recent Smartless episode marked the first time that he actually addressed these plastic surgery claims. Cooper laughed along and said that strangers have actually been approaching him telling him that, hey, you look good, Brad. But he didn't exactly address the plastic surgery speculation. So let's take a look and see what we think. I'll also reveal how much Bradley may have spent on some of these speculated procedures. So watch till the end to find out. In the year 2000, at the age of 25, Brad has a prominent widow's peak, which is that central tuft of hair right at the central hairline. He also has slight frontotemporal recession. Bradley has low-set brows, and they appear quite flat, which is a common configuration in men. He also has proportional horizontal thirds, so if you look at the general measurements from hairline down to glabella, and from glabella to base of nose, and base of nose to the bottom of his chin, those proportions are fairly equal. He has slight upper lid hooding of his upper eyelids, more on the right than the left. Brad has a thin upper lip, and he has some upper tooth show on repose when he just parts his lips. He also has a strong chin. In 2001, at the age of 26, you can see that Brad has frontotemporal recession here that's affecting not just this corner here by the hairline, but also a portion of the temple itself. When I look at his nose, I notice that there's a narrow dorsum, there's nasal tip bulbosity, and he has slight dorsal convexity, which is just a small little rounding to the top of his nose. And when he smiles, you can see obvious crow's feet developing at the sides of his eyes. In 2002, at the age of 27, I wanted to point out here that Bradley naturally has medial cheek fullness, more towards the center of the face rather than laterally based fullness. He also has some infraorbital hollowing, which is this area right down here at the lower eyelid as it transitions over to the cheek. In 2003, at the age of 28, I would like to highlight here that Bradley has an acute cervicomental angle, which is this portion of his neck. That's why his neck looks so well sculpted and defined, because his hyoid is set superior and posterior, and he doesn't have really any tissue hanging here because of that acute angle. In 2004, at the age of 29, you can really see here that when Bradley smiles, he has lateral upper eyelid hooding. He has it at rest, but it's amplified with the smile. In 2005, at the age of 30, I see no change. And in 2006, at the age of 31, I also see no change. In 2007, at the age of 32, you can see that Bradley wears his hair combed forward. And that's a very common type of hairstyle when people have some frontotemporal recession. That's a way to hide that recession. So perhaps it was progressing around this time and he felt the need to cover a portion of that area up. And in 2008, at the age of 33, with his hair pushed up and back, you can see that there's an M-shaped hairline configuration developing here. Keep a close eye on this area as it appears to change later on. In 2009, at the age of 34, I see no change. And in 2010, at the age of 35, I see what looks to be a potential hair transplant. Let me explain. The hairline has a very different shape compared to years prior, and the height of his hairline looks different to me compared to 2008. If it were true, it seems like the design that they selected for the hairline has more of a convex type of shape, which is my preferred shape. Here's an example of one of my recent patients. Contrast that with a more concave type of hairline that accentuates that M shape and sometimes in a more exaggerated manner can look like Mickey Mouse. And it looks to me that as part of the hairline work, they may have augmented his right temple because the right side was more receded than the left. And it was very naturally done because it's very difficult to tell that any type of surgery was performed. There's excellent irregularity at the hairline, and there's wonderful use of single hair grafts as well for very nice naturality. And they've done an excellent job of blending the transplanted hair with the pre-existing hair in that region, which also takes an artistic eye and strong technical skill. I wanted to take a moment and highlight the importance of finasteride or dutasteride for preventing further loss, especially in a man who's had a hair transplant at the hairline, because any additional progression of hair loss will potentially look less natural and you'll have to keep chasing it with more and more surgery, and you might down the road run out of grafts. So it's critical to have some foresight here and to play the long game and to prevent any further hair loss from occurring. That's done with the use of DHT blocking medications like finasteride. And a common place where people get their finasteride these days is feelconfident.com. So if you're interested, go and check that out. And remember that natural hair transplant work should be undetectable. That's actually the goal. So when you walk around and see people with a very obvious transplant, that's probably not where Bradley went. In 2011, at the age of 36, what I'm seeing here is the potential introduction of Botox to the glabella and the forehead. It looks like there's less activity in the forehead and in the area between the eyebrows, because at 36 you'd usually see more wrinkles. And in 2012, at the age of 37, I see no change, and that's the same through 2021. In 2022, at the age of 47, I'm seeing here the potential introduction of lateral cheek filler. Remember what I said earlier, with Bradley's natural anatomy, he did have some medial cheek volume that enhanced as he smiled, but you didn't see it extending all the way lateral along the zygomatic arch. That to me spells the potential introduction of some high G' hyaluronic acid filler that may have been used to give him some more volume in that region. There's definitely some deflation that occurs with time as we age, so perhaps he was looking to counter some of those effects with the use of filler. In 2023, at the age of 48, I see no change. In 2024, at the age of 49, I think his hairline still looks great. And the fact that he's retained his crow's feet and does not have those paralyzed with neurotoxin, I think actually brings out a lot more naturality to his face. Had he paralyzed the orbicularis oculi muscle laterally, that would have changed his appearance even more. And in 2025, at the age of 50, this is around the time when people really started to chatter about like what happened to Bradley's face, what did he do
Did he have a facelift? You know, what changed? So I took a close look, and from what I can tell, the main thing that I see when I look at his face is that his eyes now look more open. To my eyes, I think his brows are still in the same low, flat position, but there's now more upper tarsal show. So more upper tarsal show with more open eyes to me suggests a possible upper blepharoplasty. Essentially, removing some excess tissue of the upper eyelid can create this type of appearance change. And when I looked closely at the area around his ears, at all those telltale signs of facelift work, I don't see any signs of an obvious facelift. His neck is still well contoured. It has always been that way for him. And with a male facelift, you'd expect that some of the hair from the beard area would be moved more lateral, closer to the tragus. And also in many videos I talk about the changes to the tragus itself and how it flattens like a pancake and gets thicker typically with facelift work, and he doesn't have any of those obvious signs. So I actually think that Bradley did not have any kind of facelift work. I think the trend has been towards celebrities being a little bit more open about some of the surgeries they may have received, and also, you know, some of the non-surgical enhancements that they've done. I think it's a little bit more common nowadays with women when it comes to most facial procedures. They're more willing to talk about it. For guys, it seems like they're maybe a little bit more comfortable discussing some hair changes with the boom of hair transplants around the world. But I still think there is some taboo surrounding men getting some other facial procedures done. And I think over time that will soon fade as well. And guys will be more open about mentioning, you know, some procedures they had without feeling like they, you know, need to carry any shame with them about that. So we'll see what happens with the trends over time, but that's just my guess with what I'm observing and what I notice even with my practice. You know, a lot of people finding us through the internet, basically paying it forward by saying, hey, I'm going to talk about what I had because I've seen your work and I'm feeling great after, you know, the work you've done for me, and I want others to know about it. So I think especially as more celebrities open up, it'll pave the way towards just a more honest and open future for everyone. And in 2026, at the age of 51, I wanted to put up this comparison between Bradley at age 51 and Bradley at age 29. Let's look at some of these differences. Starting from the top and working our way down, we see that Bradley's hairline looks much more robust now. Despite some potential neurotoxin that he may have been receiving, the glabellar rhytids, or the wrinkles there between the eyebrows, are still a bit deeper set compared to him in his 20s. He is aging after all. There's also more supratarsal show, as we talked about previously, and his cheek volume appears to be enhanced. Also, his skin now appears to be more rejuvenated than Bradley in his 20s, so he may have some advanced skincare routine, he may be doing some laser resurfacing to basically upkeep that excellent skin of his. So overall, I think Bradley is aging incredibly well, with maybe some small tweaks along the way. And the total cost of these potential procedures is $110,000. Tiger Woods, a legendary golfer, cultural icon, and one of the most recognizable athletes in the world. But as his career has spanned decades, fans have noticed more than just changes in his game. They've noticed changes in his hair. Today we'll explore the journey of Tiger Woods and try to determine if he's had a hair transplant. In 1994, at the age of 19, we can see that Tiger has hair that is somewhat curly. It's not the curliest type of hair that exists, but it does definitely have a curl to it. And curlier hair does provide better coverage for the scalp. Usually, the curlier one's hair is, the less overall number of follicles that exist on their scalp. But each follicle actually provides better coverage, so it can look quite full with fewer hairs. And Tiger's type of hair tends to be rather straight under the skin surface. When we do hair transplant surgery, most hair types tend to be fairly straight under the skin surface. As you get to the really curly hair, then you start to have a more curved follicle, and we need to adjust our surgical technique for that hair type. But in Tiger's case, his hair type does not pose as much of a technical challenge for hair transplant surgery. But Tiger has good overall fullness here and maybe some slight temporal peak weakness. In 1995, at the age of 20, we see here that Tiger has a widow's peak, and that's that area right in the center of the hairline that comes down a little bit. He also had proportional horizontal thirds at this point in his life.
In 1996, at the age of 21, I see no change. In 1997, at the age of 22, we're now starting to see some frontotemporal recession happening. It's very mild, but it's clearly there compared to just a few years before. And we see with this image from the back of his head that he has a strong donor supply. For most men, that amounts to about 6,000 to 8,000 grafts that can be harvested from the donor area over the course of usually several procedures if needed to be able to use in other areas, like, for example, the frontal scalp or the crown or wherever it's needed. Of course, some people have weaker donor areas that may not even be able to support that many grafts being harvested without thinning out the donor area more significantly. And it's interesting here to see Tiger's hat indentation line. You can see where along his scalp that's forming, and that is around the level of where an FUT scar would be. More on that later. In 1998, at the age of 23, I see no change. In 1999, at the age of 24, we see in these images that Tiger now has some temporal thinning. That's the area right here, right above the sideburns, that in his case you can clearly see is starting to thin. And you also can see that right at his hairline, Tiger's hair is starting to miniaturize. So you can see that the more youthful type of rounded appearance to that frontotemporal corner is starting to look thinner, and that's what's going to fade as he ages. And as most of us age, we start to lose that configuration and we start to have a more pronounced frontotemporal corner. And that's why when we do surgical hairline designs, one thing that we usually avoid in men is creating that roundness, because as people age, they no longer have that naturally. So again, with hair transplant surgery, it's very important for us to create a natural look for someone. And we want it to look natural, not just when they're young, like in their 20s and 30s, but way beyond that, right? When they're older, they have this more permanent hair. We need it to look natural. And that starts with proper surgical planning and design of the hairline. We don't want to take young guys, give them exactly what they're asking for, which sometimes we know is not going to be a natural look later on. And then as time passes, they might regret the decisions that they made earlier in life. So it's very important for hair surgeons to really guide their patients to create the best possible results, not just for now, but way into the future. In the year 2000, at the age of 25, we see that Tiger now has frontotemporal recession that has slightly progressed. And he's now entering into that decade that I sometimes talk about, ages 25 to 35, where most guys will experience an acceleration of their hair loss. I think we should call this decade maybe the recession era. And so many patients reach out to me in this decade of life and they're trying to get a transplant. But if they're not on proper medical therapy, it's usually best to wait until their hair loss pattern is more defined and something that resembles their more end stage of hair loss, rather than jumping in with a big transplant, let's say to the hairline, when they're not properly medicated. That is fraught with lots of problems later in life. So again, it's very important to be on medical therapy if you're considering hair transplant surgery, or if you're just trying to prevent further hair loss and thicken up what you have. So again, the two main medications that I always talk about on this channel are finasteride, or its stronger cousin dutasteride, and that's for preventing further loss. And then we have minoxidil, and minoxidil works by thickening up our existing hair, but it's not preventative. So it's not just about choosing the medication based on which side effect profile you prefer. It's about choosing the right medication for what it is that you're trying to achieve. And usually it's that combination of preventing further loss and trying to thicken up what you currently have that leads to the best results. And then you take that stable foundation and you start to include a transplant to augment the results, and then you can get a very nice final outcome that will be sustained over your whole life, ideally. In 2001, at the age of 26, I see no change. In 2002, at the age of 27, when we compared Tiger's images here, especially that right three-quarter view, back to how he looked at the age of 21, we can clearly see the frontotemporal thinning that has developed. This is something that's progressed with time, and this is one clear sign of androgenetic alopecia. And people People will often ask me, what Norwood scale they are. As many of you know, I'm not the biggest fan of the Norwood scale for clinical use because the reality is there are hundreds, if not thousands, of slightly different variations of male pattern loss. So to put all of that into 7 classes of the Norwood scale is not exactly giving justice as far as how people actually present in real life. But if you were to pin me down for a Norwood scale of Tiger's case here in 2002, I would call it about a Norwood 2. In 2003, at the age of 28, I see no change, and that's the same through 2005. In 2006, at the age of 31, we're seeing some progressive frontal scalp thinning. And that whole frontal scalp region, you can almost see where the demarcation is in the back half or the posterior frontal scalp, where that hair starts to thicken. Everything in front of it is starting to look much thinner. So in addition to the recession that's happening, there's also a general thinning of that frontal scalp. Some people start to lose more hair in the crown initially, and other people tend to have more of a predominant loss in the frontal area. And for some people, it starts to go in both areas around the same time. That again goes back to these slightly different patterns of androgenetic hair loss that exist in nature. Tiger's crown here is starting to show maybe some very early signs of thinning, but is overall fairly intact. In 2007, at the age of 32, we're now seeing that Tiger's hairline appears to have shifted up. We can clearly now see more of his upper forehead. And that brings out some of the curvature that exists in that upper forehead. And he's now lost some of the finer hairs of his hairline. And you can especially see that with the thinning of the widow's peak as well as the rest of that central hairline. In 2008, at the age of 33, we're now seeing additional temporal thinning that continues, and there's a near loss of that anterior peak of the temples. The temples are now starting to take on a straighter type of configuration rather than having that anterior peak projection, and that adds to the size of the forehead. It's not just the recession that's occurring going up and also on a diagonal, it's also that lateral extent of the forehead that is now expanding due to the loss of that anterior temporal peak, and that is definitely something that people notice. They can't always put their finger on it, but it's that loss of the temples that creates the lateral expansion of the forehead and makes it look bigger. Also, Tiger's crown loss is starting to be more visible, especially when you look at someone's hair from a profile view. When the crown is intact, there's a nice rounded contour from the frontal scalp to the mid scalp going down into the occipital area if the crown is filled. But when the crown starts to thin out and it starts to become a bit more deficient in hair, you'll start to notice that there's a flattening of that area. And so that can of course be seen from the posterior view, but from a profile view or a lateral view, you can very clearly see that contour change when people have a crown deficiency. In 2009, at the age of 34, I see no change. And in 2010, at the age of 35, I also see no change. In 2011, at the age of 36, Tiger is starting to experience even more forehead show as that hairline creeps up. And that, of course, will be highlighted even more when he's exposed to bright light, especially the sun. And you can see that in this image. And that light penetration is often one of the biggest complaints I get from my patients who come in with a thinner frontal scalp. They'll often be bothered by how much the light is penetrating towards further back on their scalp. In 2012, at the age of 37, what we see here is that Tiger's hairline is looking a bit stronger. And when I look at the side of his scalp, in that occipito-parietal scalp, I'm seeing what could potentially be some signs of FUT scarring with some cross-hatching. When we close an incision, if there's tension that builds up on the closure, the scar will sometimes have some vertical cross-hatching, so that it's not necessarily just a straight line across with, remember, the FUT type of surgery,
that was a strip type of removal. So instead of just that linear scar, you can sometimes get these kind of vertical extensions if too much tension is built up in the closure, or sometimes if suture material or staples are used where they don't dissolve as quickly and sometimes leave those marks. There's of course an art to closing any incision, and the same holds true for FUT incisions. And even though that's fallen out of favor for men these days getting hair transplant surgery, and most people are doing FUE surgery, including us, there is still a time and a place for FUT surgery for both men and women in properly selected individuals. But I think that perhaps, especially in 2012, this was not exactly prime time for FUE. It was still at a time when FUT surgery was the predominant way to harvest hair from the back of the scalp. And I do see some indication of that possible scar line there. And I think that perhaps the hairline has improved. So he may have had a procedure around that time. And in 2013, at the age of 38, what we see here is that Tiger's hairline is now overall a bit lower compared to how it was in the 6 or 7 years that preceded this. But we're still seeing continued thinning of Tiger's hair in that whole DHT sensitive zone. In 2014, at the age of 39, you can see that from that profile view, part of that potential FUT scar is visible. In 2015, at the age of 40, what we're seeing here is that Tiger's frontal thinning progresses, and possibly only his transplanted hair is what's actually remaining in a good portion of that frontal scalp. And this again highlights the importance of proper prevention of further hair loss, or else surgical outcomes are not always that impressive years later if you didn't take the right measures to properly secure your existing hair. And that's one of the main reasons why I say no to people when they come in for surgery. It's because their hair is not stable. You have to stabilize hair loss before you operate. Hair surgery should not be seen as like some emergency. It's better to take your time, take the right steps to stabilize hair before we go in and operate. In 2016, at the age of 41, I see no change. In 2017, at the age of 42, we're seeing here some progressive crown loss. And I think that the primary population of hair in the frontal area is actually the transplanted grafts. Remember that even after the age of 35, there's still progressive loss of hair. It's just usually occurring at a slower rate compared to men in their late 20s and early 30s. And for some people, that can lead to a still nearly bald appearance without any proper intervention. In 2018, at the age of 43, what we see in the side view of Tiger is that the FUT scarring, to my eye, appears more severe. And that could suggest some general thinning in that donor zone with the progression of androgenetic alopecia, especially because some people tend to be diffuse thinners, where even in the donor area, there's some loss of hair that occurs. Or it could mean that potentially he's had some additional procedures that now has led to that FUT scar looking even more pronounced. As you go back through an initial FUT scar and say remove the scar and remove some additional hair to transplant again, you are now building up more and more tension in that closure as the scalp gets tighter. And as you do that, that scar can start to widen even more and create a less favorable scar. Remember that scalp laxity is limited, and the more tissue you remove, the tighter it gets, and you cannot just continue to do more and more and more FUT surgery. Eventually, there's going to be a limit to how much you can actually remove. But most people can undergo usually between 2 and 3 FUT procedures safely without building up too much tension in the occipital area. And again, here, I think that most of the hair in the frontal scalp is the transplanted grafts, not so much his original hair. And as far as graft count goes, between the maybe 2 FUT surgeries that he had, I think perhaps this was a total of about, I'm guessing here, maybe 3,000 grafts to the frontal scalp and to part of the mid scalp. But I think that the crown was largely omitted when it came to grafting. It looks much more bare compared to even the frontal scalp and mid scalp.
In 2019, at the age of 44, we see that his potential FUT procedures have allowed him to essentially have some semblance of a hairline still, especially in the right lighting and maybe with the use of, let's say, topic powder for camouflage. He's able to present as someone with a hairline with some framing of his face. And as far as hairline design goes, it looks like they selected a straighter type of appearance to Tiger's hairline. In certain ethnicities, a straighter hairline is more acceptable. In other ethnicities, it's better to create a bit more curvature to the hairline for naturality. But the key here, I think, is that they kept the hairline at a higher level and didn't drop it down too much. And I think that's super important, because had the neo hairline been placed too low, it would have created a very artificial appearance where you'd have hair at a level where it doesn't typically exist in a low density type of format. Whereas by keeping Tiger's hairline at that higher level, it's made it difficult to even tell that perhaps this was a surgically kind of modified type of hairline. And I think that was really good strategic planning on the part of his surgeon and him as well. Of course, he was a big part of this decision making. And when you compare what I think is FUT scarring to how things looked with the indentation of just Tiger wearing his hat, I think you can appreciate a very distinct look of FUT scar compared to the indentation of a hat. In 2020, at the age of 45, notice that Tiger's transplanted hair alone is not coming close to his original density. Part of that has to do with the limited supply that exists on the back and sides of the head that we use as our donor areas for the actual grafts that get moved to the new location. And just like with FUT surgery having limitations, FUE surgery also has its limits. And as you start to cover more and more ground with the transplant, with say a same number of grafts, you're going to start to reduce your densities. And when you're doing the initial procedure with a lot of existing hairs in the area, you need to account for that hair. But if a lot of that hair starts to fade out and all you're left with is transplanted hair, well, then it will likely take on a thinner type of appearance. And some people come back wanting more density, but again, they're going to continue to deplete that donor area. So that again highlights the importance of medical therapy. You want to secure what you have and then build on it with surgery if needed. In 2021, at the age of 46, I wanted to highlight here one of the issues with FUT surgery, and one of the reasons why most men come in having zero interest in FUT. They just want to hear about FUE. And the main reason is that you have these linear scars on the back of the scalp that can be a dead giveaway that some surgery was done. And one way to hide those scars, at least partially, is to grow the hair out longer in the back. But as the transplanted hair here, like you can see in Tiger's case, is quite thin, a better overall look for him might be one where he goes really short on the sides and the back and fades up into somewhat thicker hair. But he's not really able to do that if he's trying to grow his hair out longer in order to cover up some of the FUT scarring. And that again speaks to one of the main limitations of FUT surgery for men. In contrast with FUE harvesting, when it's done properly, you are able to keep the back and the sides very short and fade up into more hair. And many of my patients do just that. And it's very difficult to perceive those FUE scars when you have, again, properly distributed FUE scarring and when the FUE harvesting is performed well, where the scars are not too big and heal well. Here's a patient of mine who had over 2,000 grafts placed into partially his crown and partially his hairline, and you can see his donor area looking very healthy after a single procedure, with the hair on the back of the scalp being extremely short. Those tiny little dot scars are really not too visible. In 2022, at the age of 47, it appears that most of Tiger's transplanted hair was likely placed into the frontal scalp and mid-scalp, because when I look at the crown, it doesn't look like it received much of a contribution of grafts. And it makes sense to prioritize aesthetically more critical zones, like the front and the middle, before you go into the crown. Now, in some people, the frontal scalp may have thinned, but it still looks intact. And if the crown is wide open, we might place place the initial procedure of grafts into the crown. So it's not always that the first hair transplant needs to go into the frontal region, but for many people that is the strategy that we take, unless of course the crown is the primary area of loss. In 2023, at the age of 48, we see that Tiger has more advanced thinning, and likely he hasn't been on a whole lot of medical therapy. And people get overwhelmed sometimes with all the different options that exist online for their hair. They're constantly having things sold to them and marketed to them, and they don't know which way to turn, what's actually going to work, what's not going to work. And what I tell my patients is to stick to the tried and true. We know that finasteride and minoxidil have been around for many decades now and are overall very well tolerated at low dosages. It doesn't mean that no one's going to have a side effect. Of course, these are real medications with real potential side effects, and I talk about that in many of my videos. But those two medications are just so critical for men's hair when they're experiencing androgenetic alopecia. And again, to find those medications at affordable prices, make sure to check out feelconfident.com. You can also see that Tiger has diffuse thinning, not just in those recipient areas, but in his donor area as well. And that again brings out those FUT scars even more. When someone is younger, you don't always know how that final horseshoe will look if they're on the road to a Norwood 7 scenario where you just are left with that horseshoe of hair. Will that horseshoe be this tall? Will it be this tall? How thin will it be? Nobody knows. So when you get a hair transplant earlier in life, you really ought to be on specifically finasteride or dutasteride to prevent further loss. So you don't end up with a scenario like this where the back is super thin. You've now moved some grafts. Some have made it, some have not made it. You have scarring that is potentially more visible. It's not the ideal scenario, but I think it still has given Tiger the ability to not appear bald because he has some of those hairs in the frontal zone remaining. In 2024, at the age of 49, I see no change. And in 2025, at the age of 49, I wanted to highlight here some options that Tiger has. One is, of course, he can just go as is. There is nothing wrong about how things look now. He can just continue to sport this look, and that would be totally fine. Another option is, of course, to just shave the head and go bald. But again, with those FUT scars, it might not be his first choice, because then people might ask, oh, what's that scar? And then of course it might seem more obvious that he had work done, which I think is totally cool to admit to, but of course many people, especially celebrities, are a little bit more secretive about some of the work that they do. Another option is to get scalp micropigmentation, or SMP, into those FUT scars. We have a video on this topic, SMP, if you want to check it out. But it's small dots of ink that are placed into the FUT scar to make it somewhat less visible. Another option is FUE surgery into the FUT scar. And sometimes you can include SMP as well to further mask that strip scar. But sometimes it's better to use the grafts that you have remaining for other portions of your scalp rather than sending them into the strip scar itself. Yet another potential option for Tiger is to do an FUE surgery with some of the remaining grafts in the back of his scalp. Maybe about 2,000 grafts invested into the frontal scalp to bolster up the density. But it's important to carefully avoid that FUT scar when doing this type of transfer. And also it's important to realize that as you do FUE surgery around that strip scar, you will thin out the area, and that FUT scar might become a bit more obvious, a bit more prominent. And that's something that patients need to be aware of. You can see here one of my patients where we did just that. We did an FUE procedure after he had 2 prior strip surgeries, and he had that vertical cross hatching that I was referencing earlier in this video. So we had to avoid that entire area, not to deplete it too much, so that he would still have coverage of that FUT zone once he heals up from his FUE procedure. Yet another option is SMP for the whole scalp more globally. Now I think it always looks more natural when there's SMP into an area that has hair, and the more hair that it has, I think the more natural the dots of SMP can blend. But of course some people like the look of just SMP sort of everywhere, and if it's performed properly, again, you can get a nice result if that's the look that you're going for, that more two-dimensional look. But 3-dimensional hair with the SMP, I think,
overall looks better than just SMP alone. And here you can see one of my patients where we actually took grafts from the back of the scalp to cover up some of the SMP that he had previously somewhere else, where it left not the most natural appearance, and we were able to create a much more natural look for him. So in summary, I think that Tiger Woods may have had 2 FUT hair transplant procedures. The first approximately around 2012 and the second around 2017 for a total of about 3,000 grafts to the frontal scalp and mid-scalp. Over the years, keen-eyed fans have noticed subtle shifts in Matt's appearance, sparking a wave of speculation about the possibility of plastic surgery. Today, we'll take a closer look at the evolution of Matt Rife's facial features, examining the changes and addressing the burning question. Has he gone under the knife, or are these changes simply the result of lifestyle changes and natural aging? Make sure to stay until the end to find out the cost of these potential procedures that Matt Rife may have had. In 2013, at the age of 18, what you can see here is that Matt has high brows. He also has nasal tip bulbosity. Matt has full lips, both upper and lower, and he has good lateral eversion to his lip. So if you follow the vermilion border from one side to the other, you'll see that there's red lip showing throughout the entire upper lip. Matt also does naturally have a strong jawline. In 2015, at the age of 20, Matt's hair appears stable at a Norwood 1. Remember that a Norwood 0 is where you see absolutely no signs of any hairline recession, whereas in a Norwood 1, you start to see some very, very early signs of frontotemporal recession. But in Matt's case, for being 20 years old, this is a very common normal appearance of his hairline. When I look at his eyebrows, I notice that they are horizontally positioned, which is a typical male type of appearance. But when you look at his lateral eyebrows, what you can notice is that there's a decrease in the hair density. This is a fairly common occurrence, especially in men, but women can also get this reduced density to the lateral eyebrows. Most people are not bothered by this feature at all. There are some people who decide to get some sort of fill-in, whether it's with microblading or sometimes an eyebrow hair transplant to improve the lateral eyebrows. But for most people, this is something that they don't even notice and are not bothered by. And when I look at Matt's filtral length, to me, it appears to be in the moderate range. In 2016, at the age of 21, what I see here is that Matt does have upper tooth show on repose. So when he just parts his lips, you can see the upper teeth, and it looks to me like he may have had veneers somewhere around this time. This type of upper tooth show is something that we see in many models, both male and female, and we have a video where we get into more detail about that. In 2017, at the age of 22, this is around the time that Matt dated Kate Beckinsale briefly. And we have a facial analysis video on Kate, so make sure to check that one out. When I look at Matt's nose, he does have a slight dorsal hump, but he really has no nasal changes when I compare to his prior appearance. But I do see some signs of possible cheek and jaw implants. There is a contour change in the lateral cheeks and in the gonial angles of his lower jaw. Compared to, say, this image from when he was 20, when you follow the contour of his lateral face down from, say, the temples all the way to the chin, what you'll see is that there's now more of a prominence around the lateral cheek and then also right here at the angle of the jaw. Let's talk about some other ways that people can enhance their jawline. There are other surgical options, and these include lifting tissue. Lifting tissue is something that you consider usually in older patients. After a certain age, usually the tissues start to sag. And so you can go through like a facelift or a neck lift to lift the tissues back and to get the jawline definition back. Another surgical option is to remove excess tissue, such as fat or some portion of muscle that is in excess in the area under the jawline. Yet another surgical option is a sliding genioplasty. This is an alternative to, say, a chin implant, where instead of putting an implant in, your own bone is partially cut and moved forward and then resecured with plates and screws so that it's now in its new position. Doing a procedure such as a genioplasty will often make the neckline sharper because of that movement forward of the bone, giving you a much more acute cervico-mental angle. Another option to enhance the jawline is to use filler. Filler can be in the form of a fat transfer. It can also be hyaluronic acid, which is the usual stuff that people are injecting, such as Restylane and Juvederm. Also, some people will inject Sculptra or Radiesse into the jawline as well. These are all options to make the jaw appear more prominent and to give it proper shaping if that is the desired goal. Keep in mind that anabolic steroids can also create changes to the jawline. And this is because anabolic steroids usually promote muscle growth. As that happens, different muscles around the jawline, especially the masseter muscles, will hypertrophy, and that could change the appearance and make it look more robust. And then we get to exercises that people can do often at home to improve their jawline. But the question is, do they really work? So for example, there's mewing, right? And that's basically taking the base of the tongue and lifting it up. So temporarily, it does look like a sharper jawline, like a more defined jawline as well, but it's highly unlikely that doing that type of movement, even if you do it repeatedly all day long, that it's going to result in a more permanent change where all of a sudden the base of the tongue is going to be in a higher position. It has no reason to remain at that higher position, even if you consistently try to get it up there. And I heard one of my colleagues refer to it as analogous to sucking in your gut, right? As you do that, you can look more presentable potentially for some pictures if that's what you're going for. But then when you exhale, you're going to release and it's going to go back to its original position. So something very similar happens in the case of mewing. There are also jaw devices such as Jawcercise. These jaw devices are ones where you bite down on the object, and by doing that repeatedly, you're exercising mostly your masseter muscles, and the masseter muscle will then hypertrophy. It will get to be a stronger muscle over time, but the question is that a good thing? Because as you use that muscle over and over, you're going to potentially stress your TMJ, right? That's a temporomandibular joint. That can get arthritic, it can cause pain. That's something you have to watch out for as you're doing these types of exercises in hopes of a more improved jawline. In 2018, at the age of 23, what I see is that Matt has some potential mild bilateral upper eyelid ptosis. And I'm seeing this based on the supratarsal platform height. For some people, this can give off a sleepier type of appearance. Many people find this to be an attractive feature. And this is something that has to do with a slight weakness of the upper eyelid. And that levator muscle can be tightened in a surgical procedure, but many people decide to just leave it alone. And again, when you compare back to age 20, Matt now has a more robust mid-face. His cheeks to me just look fuller, both in the lateral aspect and the medial aspect. In 2019, at the age of 24, what I see is that Matt now has a more demarcated depression in his mid-face. So between the cheek complex and the lower jaw, there's now this hollowing or this depression. Now, this could be the effect of the implants, or this could be the result of buccal fat removal. And we have numerous videos on buccal fat removal, whether you should and should not get it, what the ultimate effects are, how you can potentially reverse it. So make sure to check out those videos if you're interested. In 2020, at the age of 25, I see no change, and that's the same through 2023. And the total cost of these potential procedures is $70,000. Hey everyone, Dr. Gary here. So this video is on Machine Gun Kelly's hair transplant surgeries. He is an awesome musician, and what I have read is that he's a great dad as well. So that is awesome, because I'm also a dad to a beautiful little girl. So make sure you watch till the end of this video, because I'll cover the summary of the hair transplants that Machine Gun Kelly has had, as well as the cost that was likely involved. I know everyone wants to know how much does it cost. 2012, what I'm seeing here are signs of male pattern hair loss.
there is more specifically frontotemporal recession that's fairly deep, and he has a preserved frontal forelock that has fairly good density to it. Then in 2013, what we're seeing here is that there's great donor density. So for someone who wants a transplant, he's a good candidate because of that nice thick hair that he has in the back. And I really dig his awesome Salvador Dali tattoo on his back under his initials. That's really cool. I'm a big fan of Salvador Dali. I've been to his house in Spain, actually. It's a pretty wild place. What I'm seeing in this photo from September 24th, 2013, he's got a well-healed FUT scar. So it's along the back of his head, and this is again September 2013. So I think that he likely got his first hair transplant in the summer of 2013. That's my guess for Machine Gun Kelly's first hair transplant. Because then in January of 2014, we see him here with a bandana on. So maybe he's covering up, the recipient area. It's possible. And in July 2014, you can see the obvious results of the first hair transplant. You can see that there is some scant density at the frontal hairline. Definitely, obviously, a huge improvement, but a bit scant, especially on the right-hand side, right lateral. And the hairline looks to me to be a little too regular. It's as if you just drew a line and put grafts along it. That's how it's looking to me at this stage. Of course, we know that it's been improved on with additional treatments, but at this stage, this is what it kind of appears to me. How many grafts did he have done in this first hair transplant? Based on the length of the FUT scar, my guess is about 3,000. So the way we calculate that is we figure that in an area of high density, as far as the donor area goes, you can usually get about 100 grafts per square centimeter. If you take that and you extrapolate it out to the length of the FUT scar, which to me looks like about 30 centimeters long, that's how you get that number of about 3,000 grafts. So that is, again, an educated guess. So then I think the second hair transplant came in about mid-2014, and it looks to me like he had an FUE procedure at this point of about 2,000 grafts. And this is based on some of the dot scars that I think I see on images taken in 2015. So then from that procedure, it looks like he had increased density at the frontal scalp. There's slightly more irregularity that's been built into the hairline design, and you can really see like a much more impressive hairline. At that point, the whole frontal scalp has been improved upon. September 19th, 2015 is where I'm seeing some signs of these FUE scars in addition to his FUT scar from earlier. And then in 2016, you can again see just the great improvement that he's had now with the FUT procedure, and on top of that, the FUE. Okay, so those two combined into a very nice outcome. And I don't believe that he's had further work. It seems to me like that's where it pretty much stopped, but he had a very nice result. I'm looking through 2017. The hairline's looking very natural. In this image from December of 2018, if you look closely, you can tell that there's a different in density from the sides and further back on his head of the hair compared to the frontal scalp. You can just see that there's a difference in the areas where he was transplanted. However, when he grows out his hair, it still looks excellent. So I think he's likely on medical therapy to maintain his pre-existing hairs, maybe a combination of minoxidil and finasteride, for example, to again maintain those hairs that were not transplanted. And then in June of 2019, he had his hair pretty short, and there is this shaved rectangle that I think is supposed to be a tattoo to symbolize one of his albums. And this is where you can interestingly see the FUT scar running smack right through that rectangular area, and you can see FUE scars in that rectangle as well if you look closely. At this point, if a patient came to me, maybe without that tattoo and shaved area, but just in terms of the scars, and said, how do I improve on these scars? I would say we can do a procedure of about 600 grafts of FUE grafts into the FUT scar. That would then help mask some of the appearance of that FUT scar, be less visible, especially in that midsection where it appears to be a wider scar. And then you can consider doing scalp micropigmentation into the FUE scars that they're scattered throughout the donor area. But overall, looking at his images from 2019, 2020, and now, he had overall great work. And let's just summarize what he's had done. So I think he had 2 hair transplants. The first In 2013, FUT procedure, about 3,000 grafts to the frontotemporal scalp. That's, this area here where he was really recessed. And I think the approximate cost there was about $10,000 to $15,000. The second transplant was likely in 2014, basically once he saw the final results of the first hair transplant and said, look, I want it to be improved even further. At that point, I think he had an FUE procedure of about 2,000 grafts to the frontal scalp to fill in the area, to increase the density, to increase the irregularity, which then leads to a more natural appearance. And that procedure probably ran him anywhere from another $12,000 to $15,000. The total cost about $22,000 to $30,000 for MGK's hair transplant.